Good afternoon. Thank you for attending this update about Jacksonville's response to COVID-19. I'm grateful for the dedicated members of our local media for keeping the people of Jacksonville informed throughout this crisis. I'll provide brief remarks this morning. We'll introduce our COVID-19 relief program partner, Gary Norcross, Chairman and CEO and President of FIS, and then we'll open the floor for questions. Also joining me for some brief remarks and questions is Sheriff Williams from JSO, Director of Governmental Affairs, Jordan Ellsbury, Fire Chief Keith Powers, and our EOC Director, Steve Woodard. The latest numbers from the Florida Department of Health report 990 positive cases of COVID-19 in Duval County, 95 hospitalizations, and 19 deaths. Our percentage of positive test results has fallen to 4.6%. Over the last 3 weeks, that percentage has dropped from a high of 6.3 on April 6th to its low of 4.6 today. As we've discussed frequently in the past few weeks, this data combined with the manageable occupancy levels at our local hospitals demonstrates that we are on the right track in Jacksonville. Of course, we'll continue to monitor these numbers very closely over the next few days, and we will take the next step toward reopening our city in the days ahead. What does that look like? The city of Jacksonville is meeting the benchmarks established by the White House to begin phase 1 of reopening our city. Restaurants, lodging, and retail should begin planning and preparing for a return to business at some time in the near future. Businesses should start formulating plans that incorporate proper social distancing and CDC sanitation guidelines. For restaurants, that may mean spacing your diners at least 6 feet apart, checking your employees' temperatures, having them wear masks, and regularly sanitizing your dining areas and kitchens. For retail, that may mean limiting person-to-person contact, wearing masks, and possibly limiting the number of customers you allow in at one time. We will give more specific guidance when we get to where a decision has been made to gradually and methodically reopen some of these establishments. Today is simply a statement and a message to begin preparing and thinking about how you're going to be able to incorporate these things. As I said earlier, we'll continue to monitor our numbers and conditions throughout the week before we take these steps. In the meantime, we must stay the course and keep doing what we've been doing. My executive order remains in effect. This includes limited beach reopenings. A reminder, the hours for the beaches are 6 a.m. to 11 a.m., 5 p.m. to 8 p.m. Activities are limited to recreational activities consistent with social distancing guidelines such as walking, biking, hiking, fishing, swimming, walking pets, and surfing. This is not a time to gather in groups. This is for exercise. No sunbathing, no towels, no blankets, no chairs, no coolers, no grills will be permitted. I would also remind you what I shared last week. And when you look at the testing requirement as you go into phase 1, the testing requirement, which is 150 tests per day per 100,000 people. Duval County has been meeting that requirement before we added the walk-up clinic last week, before we went into partnership with Walmart for additional testing, and before the additional testing sites we're going to be adding in the weeks and months ahead. Along with severe illness, this virus and the subsequent response has brought economic stress and hardship to many families throughout our community. Last Friday, Council Vice President Tommy Uzuri and I filed a $159 million relief package with the City Council. These dollars will address individual relief, sustained testing in every corner of our city, and many other economic stimulus measures that will benefit businesses and nonprofit entities struggling during this time. I am encouraged by the support of the City Council throughout this pandemic and look forward to their consideration and passage of this legislation today at 1 o'clock. One part of the legislation I'd like to highlight is that it allocates $40 million in direct stimulus for individuals to help with mortgage, rent, and utility payments. This program will provide 1,000 relief to 40,000 households. This important aid package would not be possible if not for the amazing collaboration my team has received from FIS. Their team has demonstrated a tremendous level of dedication and support for our community and their hometown. FIS is assisting in this effort by issuing the 1,000 preloaded pay cards to ensure recipients get the money as quickly as possible without having to absorb added fees. To talk more about FIS's role in this program and their support for our community, let me turn the meeting over to Gary Norcross, Chairman, President, and CEO of FIS. Gary.
Thanks, Mayor. And we are really proud of your personal effort and commitment to drive legislation to allocate these millions of dollars in Federal CARES Act funds to provide relief to the citizens of Jacksonville. This is going to be an outstanding boost to the community and families of Jacksonville. As a critical infrastructure provider for merchants, banks, and capital markets globally, FIS is delighted to call Jacksonville our home. And for that, we're very proud of doing our small part by not only issuing the cards, but also processing the cards for this very needed assistance. For us, as we think about our guiding principles at FIS, one of our guiding principles is winning as a team. And as you know, this COVID pandemic requires a team to defeat. So we're happy to do our small part, and it's a pleasure to give back to the city that we call home. Thank you.
Thank you, Gary. I really appreciate the collaboration and the partnership with all that you and your team are doing in this effort. We're going to be training city staff throughout the week on how to process applications for this aid, and we'll announce information on how citizens can apply soon. This morning, I helped our Emergency Operations Center team distribute our 1 millionth piece of PPE equipment. Throughout the crisis, our Emergency Operations Center has been working with area hospitals, medical providers, and assisted living facilities to ensure they have access to the equipment they need to better protect their patients and employees. I'm grateful to the men and women of the Jacksonville Sheriff's Office, Jacksonville Fire and Rescue Department, and everyone on our emergency management team for this remarkable accomplishment. Amazing job, team. Thank you for working to keep people safe. Before we conclude this briefing, I want to provide a moment for the Sheriff, the Fire Chief, and our Emergency Operations Center Director to make a few brief remarks. Sheriff Williams.
So thank you, Mayor. Just a couple quick comments. I want to take a minute and thank the community for their cooperation. We've asked a lot of them over the last 6 weeks, and we've had, again, just a lot of cooperation from the community and all the things we've asked them to do. And then we would ask them, obviously, as we move forward, and start talking about opening, just a little patience as we, again, as we move to reopen the city in phases. And just a quick note for us, we still have a very low percentage of police officers who are impacted by quarantine. Again, some symptomatic, others just because of contact. Same with corrections officers and inmates at the jail. Very low percentage being quarantined and no positive cases at the jail. So my hat's off to that corrections team at the pretrial detention facility for the work they've done there. And, we'll continue to monitor that every day. So with that, I'll turn it back over to you. Thanks, Mayor.
Thanks, Sheriff. Chief Powers.
Thank you, Mr. Mayor. Good afternoon. I have a quick update. We only have 3 people now that are out, firefighters that are out due to the coronavirus, and expecting to get some of those back in the next few days. So our numbers have dwindled down to about nothing. And that's allowed us to kind of start giving back to the community a little bit. This morning, we went to Wilson's Children's Hospital, and we normally, a couple of our fire stations provide an ice cream party for those children that are sick in that hospital, and they've not been able to do it due to social distancing. But this morning they went out and were able to do it from outside the building with a ladder truck and some teddy bears, and that's just uplifting to our spirits and uplifting to those children's spirits. So it's a little something that we're involved in today.
Thank you for that, Chief. Director Woodard.
Yeah, so thank you, Mr. Mayor. As you mentioned, we have been actively distributing personal protective equipment, especially to healthcare facilities and those that are most vulnerable. Over half of that 1,663,000 pieces have gone to nursing homes and assisted living facilities where the people may in fact be most vulnerable. We've also continued other missions with the testing at Lot J and at Cooker Park, and everything there is going well. It's open 7 days a week, and we encourage people to get tested. Thank you.
Thanks, Director. Before we wrap up and go to questions, a few reminders. My team is constantly updating a list of resources for individuals and businesses on the city's website at coj.net/recovery resources. This includes information on social services, financial relief, mental health counseling, trauma support, and disaster loans. Also, remember to be mindful and caring of those who struggle with addiction, depression, thoughts of suicide, and domestic abuse. If you know someone, consider giving them a call to check in. Let them know you care. Help is available for those in need. I would also remind people tonight at 7 o'clock to call somebody you haven't talked to in a while or someone you care about. Listen to them and share with them and just connect with them. You'll be better for it, as will they. Thanks again to our local media for covering this and keeping the public informed. With that, we'll take questions. And the first question is Jim, WJXT.
Mayor, two things. First off, on reopening the city, I know there's no date set, but what would be the earliest possible? Like, are we talking next week, next Monday, or later on through the month? I know there's decisions to be made. My second question is on the stimulus package, and that is, I know the $1,000 goes to a household. What constitutes that? Can it be different people in a household, like roommates? How's that going to work, and when will all of that be available?
One per household to answer the second question. The next question is no date is set. But what I can tell you is we are consistently meeting the requirements to enter phase one over a 14+ day period. We have testing in place that meets the requirements that the experts say you need, and we're expanding that testing. So we're monitoring it daily, but it is time for retailers, restaurants to start thinking about the ability to space tables, the ability to protect entry points, maybe think about reservations only. Again, none of this guidance has been issued yet with specificity, but this is what we're looking at and thinking about. Masks for employees, the ability to disinfect, to start thinking and planning for that now. And then we'll give enough time so when a reopening happens, people can react accordingly and do it in a safe way. This will be incremental and thoughtful and do everything to minimize. We don't need people in compact spaces for long periods of time. So I think the governor said this weekend, and I concur, I said it last week, you're not going to see concerts anytime soon. You're not going to see large groups of people together. The CDC guidelines right now is 10, and that's where we're going to remain for a period of time. Mike with the Daily Record.
Yes, hi, good afternoon, Mayor. On the stimulus package, what will the city contract with FIS cost the city if the city council approves the bill this afternoon? And then second question, is there going to be a specific revenue loss threshold that a city leasee or renter will have to show in order to qualify for this stimulus? And will there be any type of clawback or employment retention component to receiving that stimulus?
Mike, so Jordan Ellsbury was supposed to join me on this call, on this press conference to get into specifics with the questions, but he, because of the later start, he's going to have to be on the city council call. So what I will do is have somebody get you specific answers to those two questions in short order. Bridget, Action News. Bridget, Action News. Ryan, Action News. Happy birthday, by the way.
Thank you so much. I appreciate that. Just two questions here. The governor says doom was predicted for hospital capacity, but that didn't come to fruition. Is it possible that was a product of the measures that we've taken? And second question that I have for you here, is there a figure just on the daily number of tests being done in the city of Jacksonville?
To the first question, social distancing works. This was, as we've said many times, the disease doesn't spread itself. People spread it. So yeah, our measures have been impactful, but we are now at a point where we've got to move towards getting people back to work in a safe way. The virus isn't, the experts say it's unlikely the virus is going to go away. I guess that could happen, but it's unlikely. And there's no vaccine right now. If there were a vaccine, then you'd have to get into manufacture, distribution, supply chains. So we're going to have to learn to exist with this for a period of time. A 6-month lockdown isn't sustainable for a lot of reasons. There's already been terrible economic impacts and other health impacts as a result of this safer at home that the country's gone through. So yes, the actions we're going to have to continue to take are what's going to allow us to live with this for a period of time in a safe way. Social distancing, don't be in groups of more than 10, and be with people that you know. and their behaviors, masks, etc. Sky with WJCT.
Hey, Mayor, this might be for Sheriff Williams or Chief Powers. Had a question come in. Do we have a plan in place to consistently test first responders as we start to reopen and things start to get back to normal? You know, these are the people that are in the community most often. And my second question was just, do we have a number for hospital bed capacity at the local level right now?
Sheriff, you want to take that? Well, I'll answer the second part of the question. Woodard may have specifics, but we've got, there's no capacity issues, not even close. Director Woodard, do you want to take that with specifics?
Yes, sir. Just to add to what you've already said, today the percentage of hospital beds for adults that are available are 49%, and the adult ICU beds occupied are at 62%. And as the mayor noted, those numbers have consistently throughout this entire event run well below the capacity for the hospitals.
And Sheriff, I think there was a question for you as well on the front end.
Yeah, so in terms of testing, so we've had for weeks now the ability to have first responders attested, tested for the virus, as has, I know, Keith's team as well. And then, we've already set into motion at the jail screening protocols for employees, just the routine coming to work screening, and we're putting those in place for coming into the police memorial building as well. So screening and testing are available for first responders.
Troy with First Coast News.
Mayor, thank you. Two questions real quick. You mentioned the millions of dollars going towards additional testing. So if we say that the curve is flattening here locally, is the additional money going to expand existing testing, or is it to sustain what's going on already? And the second question I have is about the $1,000 stimulus check. Would that also be able to be used for small businesses paying their commercial landlords for their rent, or is it specifically for housing?
Specifically for housing. We do have the Small Business Relief Program through our partnership with ViStar and then the federal government with the PPP. The testing question, we expanded last week with a walk-up. We're currently expanding with Walmart, and we will be doing additional expansions as well as we begin to reopen things. Megan with Action News.
Hey there. So I have a few questions about the reopening. I know that you said that was going to be a conversation in the next couple of days. Who will be in these conversations? Who are you guys consulting with? I know that you said it would be implemented in about a 14-day period. How would all of that work? And lastly, do you think that this is the safest thing to do?
So the conversations are, I'm talking regularly, both formally on scheduled calls with hospital CEOs, and physicians are on those calls. And then I call them and talk to them throughout the week. We have the 14-day number I cited comes out of the White House guidelines. You have to have a decrease. There's a metric, a decrease in percentages and some other things over a 14-day period. We've had that. And working with the governor's team and his task force as well, all collaborating on guidance. Look, I said this last week, without a vaccine, the only way with 100% safety is to stay home. But we can't stay home for 6 more months. It's just, and this is gonna probably be with us for 6 more months. So the safest thing we can do is to learn to live our lives with some sense of normalcy and economic recovery in jobs in a way so people can feed their families, so they can get treatment for other ailments. I mean, we had physicians, I've heard our own physicians talk about it in Jacksonville. I was watching the governor's press conference in Tampa where people aren't coming to hospitals for things that they, heart pain, chest pain, broken bones, etc. So the safest way forward is to get people back to work with social distancing, encourage telework, working from home, masking when you're in grocery stores, getting essentials and whatnot, and staying away from heavily populated, dense settings where people are around each other for extended periods of time. Last question, Jim with WJXT.
Mayor, a lot of people have questions on the stimulus plan. You already had asked them not to call 630 City until we come up with more answers on this. But do you think after the council passes this today, I know they have to set up appointments. Eventually, they're going to either come down to the library or to the Ed Ball building to pick up those stimulus cards. Is something like that safe? What are they going to have to bring? That type of information. I mean, and the people really want to know now because they are asking those questions.
Yeah.
Our phones have been blowing up. Also, on testing, can anybody get tested now? Do you have to be symptomatic?
Yes, anybody can be tested now at certain locations. As it relates to process procedure to pick up these cards at the two buildings, yes, they walked me through the protocols. There's going to be strict distancing processes implemented and managed by our team. Masks will be on both parties. Disinfecting where people have been in the building is when they move. So the process is organized in accordance with CDC guidelines, social distancing guidelines, and all the things that we need to do to stop the spread. And Jim, we can walk the media through the process with great specificity. Thank you, everybody. Stay safe and keep social distancing.